Diabetes. Diabetes is a major public health concern that affects millions of people worldwide. According to the World Health Organization, an estimated 463 million adults were living with diabetes in 2019, and this number is expected to rise to 700 million by 2045. In addition, diabetes is a leading cause of death and disability, with an estimated 4.2 million deaths attributed to diabetes in 2019. These staggering statistics highlight the need for increased awareness, education, and action to address this growing global health crisis. In the United States, the Centers for Disease Control and Prevention estimates that 34.2 million people, or 10.5% of the population, have diabetes. Of those, 7.3 million are undiagnosed. In addition, an estimated 88 million adults in the U.S. have prediabetes, a condition in which blood sugar levels are higher than normal but not yet high enough to be diagnosed as diabetes. One of the most concerning trends is the increasing prevalence of type 2 diabetes in children and young adults. According to the International Diabetes Federation, the number of children and adolescents living with type 2 diabetes has increased by 4.8% per year between 2000 and 2019. This is largely attributed to the rise in obesity and sedentary lifestyles among children and young adults. The two main types of diabetes are type 1 and type 2. Additional, there is prediabetes and gestational diabetes, which is related to pregnancy. Diabetes is a chronic health condition that affects millions of people worldwide. It occurs when the body is unable to properly use and store glucose, which is a type of sugar, in the blood, leading to high blood sugar levels. Let's talk about the two main types of diabetes, type 1 and type 2. Type 1 diabetes. Type 1 diabetes, also known as juvenile diabetes or insulin-dependent diabetes, is an autoimmune disorder in which the body's immune system attacks and destroys the cells in the pancreas that produce insulin. Insulin is a hormone that regulates the amount of glucose in the blood. Without enough insulin, the body is unable to use glucose for energy and blood sugar levels become elevated. Type 1 diabetes is typically diagnosed in children and young adults and requires lifelong treatment with insulin injections or an insulin pump. Type 2 diabetes. Type 2 diabetes, also known as adult-onset diabetes or non-insulin-dependent diabetes, occurs when the body is unable to use insulin properly. This is known as insulin resistance. As a result, the pancreas produces more insulin to try to compensate, but eventually it is unable to keep up with the demand. Over time, high blood sugar levels can damage the body's organs and lead to serious complications such as heart disease, stroke, kidney disease, and nerve damage. Type 2 diabetes is typically diagnosed in adults but is increasingly being seen in children and young adults, particularly in those who are overweight or obese. Treatment for type 2 diabetes typically includes lifestyle changes such as eating a healthy diet, getting regular physical activity, and maintaining a healthy weight. Oral medications or insulin may also be needed to help control blood sugar levels. Summary. In summary, both type 1 and type 2 diabetes are characterized by high blood sugar levels, but they have different causes and risk factors. Type 1 diabetes is an autoimmune disorder that requires lifelong treatment with insulin, while type 2 diabetes is caused by insulin resistance and can often be managed with lifestyle changes and medications.